Welcome. We are back with another Amputee Coalition AC News Flash, and thank you for joining us. This is the space where allies, friends, partners, and friends of the Amputee Coalition come together to share highlights, updates, and really take the time to connect. Today, we have another incredible community member joining us for a valuable conversation on how we create spaces for lived experience and for our community members, Black, Indigenous, and people of color, who are living with limb loss and limb difference and bringing folks together. Latoya Muckles is part of the Amputee Coalition's BIPOC virtual support group and also recently completed the Certified Lead Advocate training. So she is all in for all things Amputee Coalition. And we are so excited to have her on our conversation today. Latoya is also a licensed social worker and currently working on her PhD in social work at Alabama A&M University. Wow, congratulations. Our Amputee Coalition support groups provide members the opportunity to connect, to share stories, to answer questions, to really just be in space together. And it's my pleasure, Latoya, to have you with us here today to tell us a little bit about that, what that's like. So welcome to you. Hello.
Thank you. Hello to you as well. Thank you so much, Cass, for having me here today.
Awesome. Well, the first thing we want to ask is a little bit about that support group environment. Can you tell us about, maybe a moment or a story or anything about what you can share from the space, what it's meant for you and how it's felt to have dedicated community for conversation?
Yes, absolutely. The group is such a warm and inviting group. And based on the confidentiality, it's difficult to share specific stories about the participants, but we talk about our challenges, our triumphs, our successes, and our future goals. We talk a lot about our practical daily living skills, such as your activities of daily living. We look at the resiliency factors in one another, and also just talking about how to improve our quality of life. The group is generally made up of individuals who are differently abled, caregivers, friends, family, Amputee Coalition volunteers and supporters. So you have different personalities and different perspectives, and we just come together to connect through shared experiences and just to encourage one another. So it's been a wonderful experience for me.
And, we've known as an organization who provides support services that it's really so important to match people up with folks who understand where they're coming from, whether it's living with limb loss, limb difference, whether it's the culture that they come from, whether it's the way they present in life. Tell us a little bit about why that is so important to the support group environment.
It's so important to a support group environment because you want to be able to connect with someone that shares your values, your heritage, your culture. Also, as that group is named the BIPOC, the Black and Indigenous people of color, for so long, our population has been considered to be a marginalized population. So not always having all of the same experiences or different opportunities. So with that, it's almost where we have to almost catch up and work a little bit harder. So we find ourselves in that space with others who have experienced some of those same differences in socioeconomic backgrounds. I personally have worked very hard to try to create opportunities for myself. I've gone to school, post-secondary education, as you mentioned, Alabama A&M University, working with community service projects and organizations. You mentioned the Certified Lead Advocate, just really giving back. So in that community, you find others who have those same goals and have those same aspirations. And for those who may have different goals and who may be different from you, it's also an opportunity for you to learn from them as well. So we just have to keep an open mind and keep open dialogue.
What would you say to people who are searching for a community to share in that way, who are looking for others that have similar lived experience? What would your advice be?
I would tell them to not stop looking until they find the perfect group, but also to be open to being in groups with people that look like you, that live the same lifestyles that you do, but also be open to meeting new people and having new experiences and having new shared experiences, because those are people that you can also learn from, that you can grow and you can grow together and connect on a different level.
And really a message for so many, like being open to new ideas and open to solutions, but also having a space where you feel included and you feel comfortable and you feel like you can belong and present as yourself and be yourself. So important.
Yes, it is. And it is a group, it's a safe space. The environment is non-judgmental. We can come talk about our thoughts and our feelings, things that maybe we've had struggles with. We talk about things that we want to do. For example, we talk about traveling and what that looks like if maybe you are experiencing limb loss or limb difference, maybe how to just get to the airport and what it looks like if you need wheelchair assistance and getting on the plane. And for those that have already done that, you're able to share those experiences, and those people that may have reservations or be nervous about it, you can let them know exactly what that's like, so that way they'll be more comfortable trying new things.
Awesome. Thank you for that. And one of the reasons that we had you join us today and we wanted to talk to support groups is because it's mental health awareness time, and especially as we head into holidays and year end, it can be an especially trying time for people mentally, dealing sometimes with everyday life, but sometimes with the unique things that times present to us. How do you feel the support group really enables you to navigate mental health challenges or helps others, or how do you think those two things are really tied together?
As a licensed social worker for the last 20 years, I have worked with children and adults that have had mental health challenges, substance abuse, sobriety issues, and that mental health is so very important, because if you're unable to maintain your mental health, then several other things in your life may be difficult for you to manage as well. So you want to always be sure that you're taking care of your mental health. If that means going to an in-person support group or finding one online, also maybe just connecting with peer advocates that you have through Amputee Coalition. There are other resources also online. There are hotlines, crisis hotlines that you can call. For instance, 988 is a good resource for those that may be in crisis. Also, there's the National Alliance for Mental Illness that you can find online at NAMI.org. And globally, internationally, you can also look at United Global Mental Health. So there are lots of resources out there, and that would be UGMH.org. But you want to make sure that you're maintaining your mental health. If that means that you may need medication to do that, you may need to see your general physician, a psychiatrist, talk to your employer. A lot of times people have employment assistance programs. I know with the state of Alabama, we have something similar to that, where you can talk about, as you said, it could just be everyday stressors. It could be health issues that you're having also that could be related to your mental health. So you want to make sure all those things work together to make you have a healthy lifestyle. So if you're unable to maintain your mental health and your physical health, then a lot of times those may correlate together and have you to where you're unbalanced or imbalanced everywhere else.
Well, such an important message to share again, right now, as we head into the year, as people are experiencing all kinds of changes in environment, the fact that the support groups meet regularly, it's an opportunity you can find on our website, amputee-coalition.org. And then all of the mental health resources you shared. When this airs, they will actually be listed in the closed caption, and people will be able to take advantage of that, because the first opportunity is to take care of yourself and connect with others who can also help you do that and support you in your journey. So thank you, Latoya, for joining us, for bringing your expertise to this conversation, your personal experience to the conversation, and for joining us as a volunteer for the Amputee Coalition. Like, so excited about the things that you're also going to do as a lead advocate, and good luck with your school, with your classes. Thank you to community members who joined the AC News Flash today to hear just a glimpse of what's available to you, and to be in community with us for just this short time. So have a wonderful holiday season, and thank you so much. Take care.
Thank you. You too. And I just want to remind everyone to invest in yourself, and the impossible goal is the one that you never pursue.
Awesome. It's that impossible goal that's like, actually, I'm possible. I've seen the memes that say that. So thank you so much.